Yeah, I'm glad you asked that. So, I mean, there are so many different directions that you could take this because of the sheer scale and offerings in DDW, the way that industry comes together to tell us about new products and services, all the way to all the new research that's being done worldwide. My little corner of DDW examines the role of quality improvement and how trainees can be involved in that. And that's something that I look forward to participating time and time again, and use that as inspiration throughout the year to help me mentor trainees and get involved in quality improvement, which is something that is so important for patients and the healthcare system in general. And I find it refreshing every year to hear the great work that's being done all across the country and all across the globe, and to try and take elements of that back into my practice and also push me to bring QI to the forefront of my activities at my institution.
My biggest takeaway from DDW is usually getting an opportunity to see. So, I'm a basic scientist working in the GI space, and having the opportunity to see how physician scientists and PhD scientists like me are working together and making progress on intractable problems or previously intractable problems and understanding how digestive diseases begin and how they might be treated. Seeing the cutting edge of that is really a remarkable takeaway for me every year. And every year I come away with new insights in what sort of signaling pathways we ought to be studying in my laboratory, and new approaches, new technologies and techniques to assess our model systems in a way that will move our work, elevate our work to another level.
Well, it's hard to say. There's so much at every DDW, and I'll freely admit a lot of it is seeing the people, which is a lot more difficult with virtual meetings. So much of the biggest takeaways come out in the hallways or sitting before a session starts and talking to people who live across the country or in other countries, and just exchanging thoughts on either what's been going on in the medical news or exactly what some of the big stories are at DDW. So I think, as I said, some of the biggest takeaways are with the people and those interactions, but there's generally several themes where there's groupings of emerging data. Sometimes it's closer to clinical practice than other times, but I think there's always something that you can take back to your own clinical practice, whether it's quality improvement type things or changes in your paradigm for considering certain and managing certain conditions, or even, sometimes a better understanding of some things that sound relatively straightforward but aren't, like the ergonomics of endoscopy, which has been a big story the past couple. And we've incorporated those at our institution. So there's always many things you can take back.
I think the greatest takeaway is just being able to figure out what the trends are in gastroenterology, and that really informs how we approach the coming year, where the research is going, what needs to be focused on, and that directly has an impact on our practice and how we go about treating our patients. So these types of conferences in DDW especially is kind of what defines how we go about treating our patients in the future.
I think the biggest take home that I see from DDW for patients comes in the way of putting one scientific session together with another abstract that happens to be a poster, that happens to be a conversation that we had over dinner. And that those connections help the clinician be innovative in how we bring something back to our patients. So I love the cutting edge information that takes place at the podium, at the dinner table or lunch table, and at the posters, which will then cascade to doing something new for our patients that we might not have thought about. So I think there's a lot of translation there and an opportunity to evolve our practice.
Sure. So I think the biggest thing I've really taken away from DDWs I've been to is how absolutely cutting edge and amazing researchers, physicians, allied health professionals can be in different areas of gastroenterology and hepatology. Every year I go, honestly, every poster I see, every exhibit I see, I learn something new, whether it's big or small. And the fact that that novelty is recurring and it's always there is the best thing that I've taken away from DDW consistently.
I think what's been nice to see is the challenges that we all face, in our clinics and in our practices are common amongst everyone really that's in gastroenterology. So it's nice to see that if I'm struggling with something, someone somewhere else is also struggling with the same problem, and people have sort of put their heads together and come together to try and figure out solutions. And places like DDW are where we're able to network and get those solutions to a broader audience and try and fix up those things that we're having trouble with.
For me, what was the biggest one was, I think, to see the collaboration between different clinical centers and with researchers, and the openness that I experienced, which is not common in many areas. But at the DDW, I could feel that. And then someone who is working in Europe, in the United Kingdom, it was really nice to see what is existing in the US and how lots of people from Europe are getting involved to those activities.
I think the biggest benefit is recognizing the variation in practice. Sometimes living in Australia and you see how things are practiced here, and when you go to DDW and you hear how other people are practicing and the variation of clinical practice, and that's what I take home every time I come to DDW, understanding that there is so much variation in practice, and sometimes for good reason.